Good evening. My name is Manny Flores, and I'm the Alderman of the First Ward in the City of Chicago, and I want to welcome you to another segment of the First Ward Chronicles. In this evening's program, we're going to be focusing on the topic of influenza, the flu, the pandemic flu, or otherwise known as the swine flu. As many of you know, as recently as last year, throughout the world, we were affected by a new viral strain, a new influenza strain that has affected many. The City of Chicago, like many other cities, was also impacted. So to that end, our city is now fighting vigorously to prepare the fight against this influenza strain that is affecting everyone. On this evening's program, we are joined by Dr. Julie Morita. She is the Medical Director of the Immunization Program for the Chicago Department of Public Health. Doctor, welcome to the program.
Thank you, Alderman Flores.
So briefly, you heard my introduction. I made several references to the influenza or the flu, pandemic, H1N1, or otherwise known as the swine flu. I think it's important that we start out from the perspective of explaining to the viewers why it was called the swine flu to begin with, and why we're moving away from calling it the swine flu today before we go on to our conversation. So just give us a little history of why it was called the swine flu, how did it come to be, and what's really true and what's myth.
Last spring, when this virus first started making people sick, the CDC and other laboratorians evaluated the virus to see what its genetic makeup was like. And they found some genetic sequences that were like that found in pigs or swine. So right away, people started referring to it as the swine influenza or swine flu. What we've learned since then is that in addition to having characteristics that are like a pig's virus, there are also some avian genetic sequences as well as human genetic sequences. And we've also discovered that nobody that got sick with this virus last year or this year in the spring were actually exposed to sick pigs. This virus did not come from pigs. And so as a result, it's really inappropriate to call it swine flu. It's much more appropriate to call it H1N1 or pandemic H1N1 influenza. People won't get sick by eating pig or pork products. They will not get sick that way. They'll get sick from being exposed to people who are sick.
And that's always important in your efforts as a doctor in terms of dealing with some of these new strains of bacterias and also of just viruses that you clarify to the public. Because I think a lot of when you're dealing with these outbreaks, you're not only dealing with the health consequences, the physical consequences, but also of the psychological or the emotional consequences associated with this, the anxiety. So the education is just as important, wouldn't you say?
Absolutely, yeah, I totally agree with you. And I think that our commissioner, Terry Mason, has been actually very active in the media and the public to try to dispel people's fears or concerns or myths about the viruses. And I think that in general, we have over the past few months, focused a lot of our efforts on making sure that the correct information is available to the public. So we have information on our websites. We have a phone bank that's established so people can call in. We're working with 311 operators so they have the correct information so they can answer people's questions as well.
So if you're watching this program, please continue, stay tuned. We're going to have some more information here, but just something that I want to clarify. It's no longer going to be called swine flu. It's not referenced as swine flu anymore. It's either referenced as the pandemic flu or H1N1. Is that correct,
That's
Doctor?
correct. Pandemic influenza or H1N1 influenza.
Very well. So, Doctor, tell us a little bit about, you just gave us a brief history of what happened in terms of how why it was named as such, this strain, this influenza strain. But what does it mean in terms of, on a practical level for Chicagoans here? We are, now we're getting close to the fall here with a change in weather. Oftentimes also people now start to develop the flu. And so how can, what's the impact of this pandemic on the city and the health and and how should we deal with it?
I think we have to put this into perspective because every year there's an outbreak of influenza, and we refer to those strains as seasonal influenza because these viruses have been around before. They cause disease every year. People don't take it seriously enough, though, because over 200,000 people are hospitalized every year because of regular seasonal influenza, and about 36,000 people die every year in the United States because of influenza infections. What's different about this virus is that this virus is a brand new virus. Nobody has seen this virus, but specifically this virus before. And so as a result, more people can get sick this year than usual seasonal influenza seasons. And so we're preparing for that because we know that more people are not immune or have not seen this virus before.
Now, I think it's worth commenting, though, that in the initial outbreak here in the city, we've already, at some level, we've already dealt with it, right? And you know, and I know you're in the program, but and it's completely unsolicited, but I think it's worth mentioning that the department did an excellent job of getting out there right away and informing people and really preventing the initial outbreak from really getting out of control. Because my understanding was that in Mexico, they did have some real challenges in trying to manage the spread of this virus. Can you tell us some of the things that worked and some of the things that we're looking to improve? And just to better inform the viewer?
Sure, I think you bring up a very good point. The spring really served as a good preparation for us for this fall. What we experienced was a relatively small wave of pandemic influenza, and as a result we had to scurry around. The health department had to get our acts together and really start getting communication messages out to the public, as well as working with school systems and businesses and healthcare facilities to make sure that we were all prepared to deal with this appropriately. A lot of our emphasis back then in the spring related to encouraging people who are sick to stay home, and also to encourage people to use good hand hygiene, wash hands frequently, cover coughs when you're sick, stay home when you're sick. Those were the key messages because we really didn't have a vaccine to offer people. This fall, we expect that the virus will come back. It actually never really went away. We've had smoldering, we've had a few cases here and there throughout the summer months, nothing to the extent that we saw in the spring, but we do expect to see more disease this fall. And we also expect to have a vaccine becoming available, so we'll have more tools to use. But those same core messages about staying home if you're sick, washing your hands frequently, covering your cough if you're sick, all those messages are really, really important messages for people to still adhere to. But then now we'll have a tool, a vaccine to get very soon.
Do you anticipate, I know there's some questions, and we were asked a number of times. We have, in my office, we represent a large number of elementary schools, several high schools. What happens, what are you going to anticipate this time around, and what's going to be the procedure in the event that there's an outbreak in one of our schools?
Last spring, before we knew what this virus was going to do, when it first got detected, we weren't certain if this virus was going to cause more people to get really seriously ill or whether it was just going to be a mild illness. This fall, we actually have a much better sense of what disease this virus is actually causing. And our sense is, based on what's happened here in the U.S. and what's also happened outside of the U.S. in the southern hemisphere and the northern hemisphere, is that this virus is relatively mild. The vast majority of people will get sick, have a fever, have a cough, not feel well, but they won't require hospitalizations. They won't go on to die. There are some people who are at higher risk for getting seriously ill, and those are people with chronic underlying conditions like asthma, diabetes, immune problems, pregnant women, young children. They're all at higher risk for getting seriously ill, but your average healthy person will probably get a fever and a cough and not feel real well. Because of that, we're more comfortable not closing schools down. In the spring, when we didn't know what was going to happen, when we identified an individual case in a school, we closed that school down.
Well, we wanted to take every precaution because, again, in Mexico at that point, it was, I mean, you had people who were very sick, who were coming on very sick, and even had some deaths reported from the virus. Is that correct?
That's right. And so because at that time, when we had our first case in a school-aged child, we knew what was happening in Mexico, but didn't know if that meant that everybody was going to get seriously ill or not. So we decided to close the school. Shortly after that, information from Mexico and also from other parts of the United States made it clear